I bet my dad.
Come to smoke cannabis. Doctor say make a pop one of this. Make me fly like say I'm Aladdin. Come bring some kind melodies. Oh mama myself no do pass like this. So many things inside of my gin. I slide down DBTs, DBTs.
Hi, good morning, everyone. Good morning again. I just wanted to let you know that we're about to move into the second phase of our proceedings for this morning. Our guests would have been joining us online for those who are joining for the virtual portion, and we'll be going into the discussion segment shortly.
I live
to love, to enjoy life, to fulfill a dream,
for my family,
To enjoy life.
Having a premature baby was expensive. Out of $1.6 million, I only ended up paying $2,500. All the tests that I had to do, it was about 2-point-something million. But thanks to my Sagicor Life critical illness policy, I was able to cover all my expenses.
I for sure encourage persons to get Sagicor Life insurance.
Thank you to Sagicor Life for ensuring that I was able to survive this without being financially ruined.
I had to be attended by nurses day and night. Sagicor take care of 3.5 million from my end. What more could I ask for?
Protect what matters most with Sagicor Life.
Hi, good morning. Welcome back. Welcome to those in the audience. Thank you so much for having been here with us. And for those persons who are joining us virtually on Zoom, thank you so much for taking the time out of your morning to be with us today. So we are here today for the Empowered to Live Well Forum, brought to you by Sagicor Life. Of course, I am Stacey Goodin, Manager, Wellness and Client Engagement, and today we are going to be taking you through some more tips and tidbits. We will be here to recognize that we can take control of our wellness. And so in this forum, we're going to be adding some more tools to our defenses. So in case you have not yet encountered the Wellness and Client Engagement Unit, we have the privilege and challenge of helping you to find ways to improve your wellness. We have a growing suite of solutions to help our clients learn and practice healthy ways of living well. So we have our Wellness Hub, we have our platforms for sharing information, and most of you would have encountered our mobile wellness unit at some point. But in this session, we're going to be delving specifically into the practice of managing prescription drugs. Now, you might think there's nothing to it, just take your medicine. But we've learned that for some persons, it's not quite so simple. And for those of us who would have been here with us from earlier, we also learned that prescription drugs is the major burden on most of our group health plans. And so having taken our responsibilities seriously to help you manage your wellness, we're having these series of forums and webinars to bring you some information and help you to manage the various challenges. And today, I have with me Dr. Melissa Williams, clinical pharmacist and consultant to the Sagicor Wellness team, who is eminently qualified to teach us how to best manage prescription drugs. And I also have Natalie Murray, health coach, who is here to bring some balance to the conversation because, managing your medication is one thing, taking your drugs to manage any illness is one thing, but the other changes that we need to make to our lifestyle to make sure that these are sustainable is a whole different story. So welcome, ladies. Thank you so much for being here. So we're going to move right into the conversation because from experience, I know this is quite a meaty topic and we have a lot to discuss. But to kick off though, Dr. Williams, let me start with you. You're going to be going through quite a bit today. Is there one thing that at the end of this discussion you'd like our audience, both in person and virtually, to take away?
Absolutely. And what I'll say is becoming a personal advocate for your health. A lot of the times we go to the different healthcare providers and persons who we think are owners of our health, but we have to take this personally, and we have to be personally accountable and responsible for the outcome of our health.
Thank you so much. Natalie, so today we're going to really be focusing mostly on medication management from a clinical perspective, but I'd like to have your advice as a holistic health coach. What do you think persons should bear in mind?
I love the topic, the name of your forum, Empowered, because that is actually what we are. We do not have to be a slave to the genes that we were born with, right? Our diets and our lifestyle significantly impacts our prognosis, our outcome, whether or not we're at the stage of requiring medication, whether we're at the stage of preventing illness. So I want people to know that everything that you eat, every thought you think, and every way that you choose to move is what is impacting your wellness. From now, not just when you're older, but from now in your 20s and your 30s, take control and be empowered.
Thank you so much. All right, so Dr. Williams is really the one who you'll be hearing from the most today. So Dr. Williams, over to you. Please take us through.
Okay, thank you so much. So we'll be looking at managing prescription drugs, and you would have gotten some preamble in terms of, what it is that we're looking at it from a clinical pharmacy perspective. And I trust that by the time I'm through with the presentation, we'll have some key things that we can take away, that we can also share with friends and family to help them to better manage in terms of their health outcomes. All right, so for introduction, we've been hearing the term medication therapy management. It's not necessarily new in terms of Jamaica, but it's a beneficial addition in terms of healthcare outcome for persons who would have been diagnosed with chronic or acute illnesses. So what exactly is medication therapy management? So it's a group of clinical pharmacy services that are offered or supported by clinical pharmacists. They're expert in the area. We say that these people are drug experts because they spent quite a long time studying and specializing in pharmaceutical items, medication, drugs that you take. So the aim of clinical pharmacy or medication therapy management, the first one we see on the board is to prevent. I think I get enough feedback. So to prevent, what exactly are we preventing? We're preventing medication harm. Now, something that is intended to do good can do bad if it is not utilized properly. And because of the specialized training that these persons have, they are able to, in a very quick way, once they get that prescription, once they have that diagnosis, to identify whether or not this is a challenge for you as a patient. It does not treat a patient as a group, it treats a patient as an individual. Our health coach would have spoken about genetics. Our genetic makeup are unique, they're different. So the person sitting next to you may respond differently than the person sitting at the back of the room and that sort of a thing. So it's very, very important that we bear that in mind. In addition to preventing, we identify. Identification becomes very critical, and this is where we weigh patient risk. As an individual, what are my risks in taking this particular medication? Sometimes we get a prescription from our doctors and we'll have it for like 6 months. I've seen prescription written for a year for persons with certain chronic illnesses. And we continue to take these medications, but we're not reviewing. And the beauty about life is nothing remains static, meaning our bodies are forever changing. And because our bodies are forever changing, we need to bear in mind two critical organ systems, which is our kidneys and our livers. So our liver metabolize majority of the medicines that we take. Our kidneys, for most of the drug that we take, are excreted by the kidneys. As we age, the functions of the liver changes, which means your medication requirements also changes. Our kidney function also changes, which means our medication should also change. The medications we're taking in and of itself to have side effects that sometimes can diminish these functions, and as such, we need to consistently be assessing these areas. And
Doctor, just to clarify though, what you're saying there in a nutshell is that I may start out with a certain prescription today, but because of age, or is there anything else that could be a factor in that?
Yes. So separate and apart from age, we're living now, and Mr. Chisholm spoke to know your numbers, or health minister is, Kurt is in the room, fitness, everybody trying to be healthy. As we change our diet, our medication needs also changes. Because, for example, for blood pressure patients, if you reduce the amount of, just a simple example, salt intake, then we need to evaluate, for example, you're taking drug A at 10 milligrams. Now that you would have adjusted the salt intake, now that you're getting leaner, much fitter, naturally your body's blood pressure is lowering. So a 10 milligram medication may no longer suit you well. It could become toxic to you, and now you may require 5 milligrams. In some cases, I would have had patients who transition entirely from a blood medication to blood pressure medication to strictly lifestyle modification. So these things are critical.
Okay, so let me bring in Natalie at this point, because you would have been seeing persons who may have been experienced, persons who come to you to consult on diet and they want to lose weight. Given what Dr. Williams has just said, if someone should come to you and they want to lose weight, they want to change, what would you say to that person?
So I always counsel people that although we're making healthy changes, you need to be in dialogue with your medical practitioner, because I cannot advise on changes in medication, but what makes you overweight also contributes to these illnesses.
Right.
So as we start to lose weight, as we improve diet, things like blood pressure, cholesterol, and diabetic medication requirements will be changing. So self-monitoring, if you self-monitor, and consulting with your medical practitioner so that the medication can be adjusted to your new healthier body.
Great, thank you. And just I want to say to the audience that the benefit we have with having someone like Dr. Williams on board our team is that you, our clients, can benefit from this. So once again, reminding you to tap into the tools that you have. We are building out these resources to help you. And so it means that if you're transitioning your lifestyle, and we encourage you to get well, if you have any challenges or any questions, please reach out, because the facility is here, and she can be available to you and your team to help bring guidance. So just wanted to make that clear. Thank you, Dr. Williams.
Okay, thank you. And of course, the most important point on there now is to resolve. So once we've identified any potential risk, or sometimes these risks are already happening to the patient, then we resolve it. So we resolve it in multiple ways. We stop, we discontinue certain medications, or we may need to add medications to it. It's a collective effort. It does not work independent of your medical doctors. We work in collaboration to it, but at the end of the day, what we're getting out of it is individualized treatment. And once you go through a medication therapy management review, what it means for you is that the collective set of medicines that you're taking are ideal for you to get the best outcome. And hence what we get out of that is improved health outcome and improved quality of life. Quality and quantity. So your number of years also increases. Something critical that we have to bear in mind is prescription knowledge. So we consistently get these at some point in time. I'm sure everyone in this room may have received a prescription, whether it's an acute illness meaning short term. So it's not long term, something that you have to take for rest of life. So it could be a respiratory infection, and you may get some antibiotics and so forth. We need to understand what we call LOP, the life of the prescription. So sometimes patients may go to the doctor because, once we start becoming uncomfortable, we go to our doctors. Say, for example, it's for an infection. We get a prescription. An infectious prescription should not last for longer than a week. So if outside of a week you have not filled that prescription, it means that you need to go back to your doctor to be reassessed to see if what was previously prescribed is still good enough for you. In terms of chronic prescription, by principle, a chronic prescription rarely lasts a year. However, on that prescription, when you receive it from your doctor, you may see 1 divided by 12. That means 1 month. You may see 2 divided by 12, 3, or so forth. Anything divided by 12 is a month. The prescription is valid for a year. But if your doctor wrote that prescription for 3 months, no repeat, you go to a dispensary. The correct thing, dispensary meaning pharmacy, is for the pharmacist not to honor that prescription if it's after that 3 months, but to send you back to your doctor. Why is that critical? It falls under the umbrella of medication review. So your doctor may have a treatment plan for you, and that treatment plan is just for that 3 months for him to reevaluate, reassess to see if this was the right choice, if you're responding. So when pharmacists say, no, you need to go back to your doctor and take that prescription, it is a health policing that works out for your best interest. If, for example, your doctor says 6/12, repeat times 1, the doctor means that he wants you to be maintained on this therapy for a year. My response to that is, if you're ever been given a prescription for a year without a review, try and get a review from a clinical pharmacist, because you should not be on chronic therapy for a year without a review because of what we call, just like chronic disease, medicines can, in a way, it stays in your body for a very long time. It's in your body for a very long time. It could be causing harm. You don't know. So once you get that review, we're preventing that. So if you're, for example, say, a lot of persons say, and from another side of my life where medical detailing was a part of it, you find where med reps would say to the doctors, okay, is your patient controlled? The doctor will say, yes, my patient is controlled. But when last have you done a blood chemistry to see if the liver function is the same, if the kidney function is the same? So that is why I said we have to become personal advocate for our health and not to say, this is the doctor, this is the clinical pharmacist, they know what is best. But we have to now become active participants in the discussion in terms of our health.
Right, thank you. Because what that brings to mind is what you said previously too, because in that 6 to 12 months, it means that changes in other habits could have also impacted and also had an impact on the efficacy of the medication. So what I would think now is that, Natalie, when persons come to you, maybe what we'll have to add now is to say, okay, inquire more about the clinical medication that they're on, to say, okay, you're seeing somebody for a course of treatment and you're giving them a diet recommendation, but we may now be given information that we are now learning. We may need to be pressing these persons to say, have you had a medical review?
Absolutely. I mean, when we do our coaching sessions, I always ask to see their latest blood work. Not that I can read it. I'm not trained that. I mean, I have my little knowledge, but I'm not trained in that. But I want to see that you're doing it, and I want to follow up. And when we make the changes, I always recommend that people go back for their follow-ups, especially if we're recommending any kind of supplementation, because where a supplementation can be beneficial, we have to monitor the impact and the interaction with medication.
Right. I'm just stressing that because, again, while I'm pushing the message, get well, we have to remember all of these various things that we have to keep a tab of to make sure that we're not jeopardizing the good work that we're putting in. So that's the whole reason that I'm just pointing that out and we're really going this. So thanks again, Dr. Williams.
If I can make one more
please.
suggestion here, what I would strongly suggest to people is that they keep their own medical records.
Yes.
So anytime they do their blood work, keep a file and you look at your trends, because not all the time does your doctor have the time in that appointment to be going through, how has my HbA1c been moving over the past 6 years that I've been doing my my executive profile? How is my cholesterol moving? Because it's not always just the point in time that you're at, but it's the trends and the direction.
Right.
Yeah.
And I know that Dr. Williams is going to have something to say about that, especially when we talk about the polypharmacy later on, because it's a challenge we have in Jamaica given our medical situation.
Yes. And medication disposal. A lot of persons don't know how to dispose of medications when they get them. The correct thing to do, and it's something that I'll suggest that we do up front once we go to the pharmacy to collect medicines, ask them if they would take back the drug if you do not consume all of it. Because the flushing down the drain, the toilet, the washing away, the throwing away in the regular disposal, that's not how it should be done. All of these things end up in her water system, and a lot of the times you see persons ending up with all kind of critical illnesses and so forth, and we don't know what the source of it is. We have to be careful. So once we have medicines, it is not a patient's responsibility to dispose of. Take it back to the pharmacy that you fill it at and you give them the excess. The same thing happens with expired drug. Now, I want to just pause a moment in terms of excess medication, because really and truly, if you're a prescribed drug, you shouldn't have excess, except in the case whereby you had a reaction and you had to immediately stop taking that drug. If it's chronic medication, you're given it for a period. So after that period, you should have consumed all of it, except again, in the case where you had adverse effect. Pain medicine is one of the highest culprit on the list in terms of patients having excess medication. So when you go to you may have an accident where you broke a limb or something, or you did major surgery, and post-op now they're giving you pain medicine. My rule of thumb to patient is never take more than 2 weeks supply of your pain medicine. They tend to give you the pain medicine for a month, but from experience, we learn within 3 to 5 days, most of the times, these post-op patients, these fractures and so forth, you go back to normal, you're not needing all of that pain medicine. So the rule of thumb is once pain medicine is on your prescription, ask your pharmacist, How much supply was I given? Or talk to your doctor from day one. How much are you giving me? So that when you get to the pharmacy, you say, only give me 2 weeks supply of this medicine. Also try to investigate how many types of pain medicine you're getting as well, because sometimes they give you muscle relaxant, anti-inflammatory, and the cocktail of this sometimes can be too much. Especially for patients who are on chronic medication for your blood pressure or kidney, a lot of these pain medicines impact the kidneys, so it's very important that we don't abuse this. So remember, the rule of thumb, no more than 2 weeks when it comes on to pain medicines. All right, so that takes us into challenges in terms of medication and the elephant in the room, polypharmacy, and we'll be exploring that further to understand what exactly polypharmacy is. Brand versus generic is also something that is very topical, and we'll explore that further. And finally, we'll look at real examples of 2 patient cases from both a chronic patient and an acute patient to see that both sides can benefit from medication therapy management.
Let me just also say, for persons who have questions, please just hold them until the end. We will be able to accommodate. And for persons who are online, please drop your comments or questions in the chat, and we will try to address them as we come to the end of the discussion.
So polypharmacy, the first on the list is the medication list. So once you're taking 3 or more medicines, we say that this is polypharmacy. And it becomes polypharmacy because we're looking at drug interaction. So drug interaction happens when a patient, well, it can happen within 2 medicines as well, but the average that we start to really monitor patients for is when they start to be on 3 and more medications. So sometimes the medicines that you're taking are actually going through the same pathway in terms of to go to the site where it impacts the results that you require. And when that happens is you can have medication that lowers the benefit of another, or you can have medication that increase the availability of another, leading to toxicity. So that's something we have to consider, and hence why we have to manage these patients carefully who are on multiple therapy. Another form of polypharmacy is multiple pharmacies. Out of convenience, pharmacy in Jamaica now is like churches in Jamaica. Every corner there is a pharmacy. And for convenience, oh, I miss my main pharmacy, I'm just going to stop at another pharmacy. I do not encourage the multiple pharmacies, because what happens is, unfortunately for us, we do not have an integrated pharmacy system that connects all the pharmacies. And once you jump ship from pharmacy to pharmacy, it means that your medication record is scattered. A scattered medication record does not help you. When you go to one dispensary, it means that that one dispensary has your total history of all the medications that you have ever taken, the ones you're currently taking, and if you get a new prescription, the pharmacy should be able, and I use the operative word should, be able to quickly identify if there is any risk for drug interaction, and hence why it becomes important to try your very best to stick to one dispensary. With multiple pharmacies, again, what you find is that the switching of medications, and when we go into the brand versus generics, we look at the harm that this can cause when we switch between generics, when we switch from brand to generic to brand, because there are implications.
Yes, I had a question, and Natalie, you'd have mentioned it earlier about supplementation. We have the issue of polypharmacy, multiple drugs, multiple doctors. How about those persons who are also now supplementing? You're taking your vitamin C and the other things that, I don't know, what are the people now taking, Natalie?
All sorts of things.
Right. When you're on long-term drugs, and given those other complications that you have already raised, what's the rule of thumb? Natalie, if you can just give an idea, what are you encountering, and then doctor, what's your advice?
I'm always going to advise people before they start, if they're on medication and they want to start trying more natural options, the first thing is to go back to your medical practitioner to have that conversation. For example, if you're on a blood pressure lowering medication and your blood pressure is controlled, but you want to come off the medication and you want to try something like L-arginine and hawthornberry, you can't just add that to your repertoire, because you're going to lower your blood pressure below where it needs to be, and that's a challenge as well, right? So the first thing to do is always go back to the doctor and have that conversation about how supplementing with botanicals is going to help. Your regular vitamin therapy should be, and I'm going to again use that operative word, should be okay. Vitamin C should be okay. But if you take something with a lot of potassium, that is going to have implications on blood pressure. So we really need to be mindful and do our investigations and have the conversations with the qualified professionals.
Right. And that's for all of us internet self-prescribed persons. These are things to bear in mind. So, doctor, what is the clinical perspective? What would be your advice to us in light of that?
Right. So we always, in Jamaica, our culture is we always try some mixture of alternative, we call them alternative herbal supplementation to help us. It is never advised that we do this outside the help of trained professional. It can be done, and it can be done safely. But what it means is that you need to be monitored more carefully. Because the truth be told, our herbal supplementations and things like those, they're very, very useful and they're very helpful, and we would have seen results. The unfortunate thing is, though, we don't have a lot of clinical research, a lot of investment to really say what proportion of these that we need to combine with what we call conventional, which is our prescription drugs. So we always say to patients, listen, even though our great-grandmother did use, but as long as we're on medications from our doctor, we can't just combine them, we can't just switch abruptly. Everything has to be done in a very well-managed and organized way. It cannot just be, I'm going to switch, I am tired of these medication, I'm just going to switch. We would have heard testimonials of persons saying, oh, I used to be on so much and I've successfully switched. We have the Jamaican saying, puss and dog not have the same luck. So now that we're empowered and we're informed, we know that we can safely do these, but we do these under the governance of trained professionals.
Thank you.
All right? And then last, we have multiple doctors. Again, we don't have an integrated healthcare system now that links pharmacy with medical practice. We don't have an integrated medical system that links all of the doctors and their diagnosis and their findings and their treatments. So we can have one patient, a complex patient, who's been seen by multiple specialists. So we may have one patient seeing a kidney doctor, a heart doctor, a doctor for the diabetes. So we have the endocrinologist, the nephrologist, the cardiologist, and then we have the general practice. There is no space where they communicate oftentimes. And what this leads to is duplication, triplication of therapy. Because when you look at the different disease states, they overlap in terms of symptoms. And a part of treatment is we're trying to correct, but we're also trying to alleviate symptoms. And when this happens, you'll find a patient overdosing and the patient goes into toxicity. In fact, majority of the readmission to hospital is as a result of no communication among the different health practitioners managing the patients, and as such, the patient ends up in the ER with an adverse reaction. Sometimes these becomes fatal, or it makes the patient immobile depending on the degree or the extent of the interaction that is happening. So that becomes very critical, and hence why I really love the fact that Sagicor has invested in terms of providing you with medication therapy management, because these are things that can, of course, be alleviated through this set of governance that you now have access to. So we're moving into branded versus generic drug. Now, oftentimes, and I'm like that too, if something costs more, we believe that the value is better. And we can attest to several examples in our lives in terms of this cost. A shoes cost this much, so it lasts longer than a shoes that cost that much. When it comes on to medication, we have our innovators, we call them our branded medications, and we have our generic counterparts. The generic drugs are drugs that, after the patent or patent would have been up from the innovator molecule, they now have access to the formulary and they can reproduce the medication to an extent. So when we look at the comparison on the board where we have, in terms of active ingredients, that is the medicine that is causing the results. If it's high blood pressure, the ingredient in there is the same from brand drug to generic drug. The branded product is always more expensive. It's more expensive because before a drug can come on the market, it has to go through extensive clinical research. Sometimes it takes 20, 25 years of investigation before the drug can come to market. So it's heavy investment, and they try to recoup. The idea is the patent should take care of that, but innovator company will never drop their prices to the price of the generic. The generic counterparts now, they have to be FDA approved. Generic drugs also have to undergo certain levels of clinical studies to show that it is similar to the innovator molecule. And hence, happily to report, on our Jamaica market, we have credible generics that are available and are suitable options at lower cost. Covered from, if the branded products you'll see in this comparison is covered if no generics are available. In Jamaica, what uptakes now is whether it be brand or generic, you're covered. But I can tell you in the international space where they're moving is, if the generic is available, they will not cover the branded products for you because you have a cheaper option that is just as safe, just as efficacious. Both are tested, of course, by the FDA. There are no difference in terms of the strength and the dosage. The tablets, however, they may look different, and we have what we call bulking agents. So sometimes the ingredient is just a small, probably grain that you can't take. You couldn't measure that. So we use bulking agents that we call excipients. So those can be different. So when somebody says the branded product and the generic is the exact same thing, it's not true. It has in the same active ingredient, but the excipients may differ. The beauty about it, though, even though it lacks the exact excipients, is that the studies would have shown that the generic counterpart is as efficacious as the branded product. Now, there's a rule of thumb that I say to patients. So I said I have experienced patients, one, and we have naive patients. Experienced patients meaning you would have been prescribed the drug already and you're already taking it. So because you're already taking the drug, I do not recommend that you switch from one drug to the other. And the reason behind this is, for a generic drug to gain approval, it is plus or minus 25% of the innovator brand. What that means is the generic drug can be 75% of the branded drug, or it can be as high as 125% of the branded drug. Switching between generic and generics too is not advised. So when you go to the dispensary sometimes, whatever the pharmacy have on the shelf, they may give it to you. You need to know your medications, know your brands. Because once you switch, you're switching the level of control within the body. So back to my rule of thumb. For naive patients, and I say this for access purposes, because oftentimes we see patients, the doctor will write the branded product because they employ medical reps who are going around and they're detailing, so the brand remains top of mind. If you're a naive patient, ask for your generic options. So once you go to the dispensary, you ask for your generic. And the reason for that is, there are certain medicines on the market and they're quite expensive. Yes, you have a health card, but the health card also has a limit. And sometimes you gain access for month 1, month 2, and then month 5, the health card run out. What happened to your management? You no longer can access the treatment. So it's an upfront conversation that we need to have with our doctor, with our pharmacist, so that you know what access you have. And every year your health card is renewed. So you make your decision based on your level of access that you have.
Right. So clarify, doctor. What you're saying is that brand and generic are pretty much similar.
Right.
So it means that you, the patient, although your doctor may write the branded name on your prescription, when you go to the pharmacy, you can ask
for the generic
version. And the rule of thumb we're saying is that the generic version is usually a lot cheaper. And for those of us, and by those of us I mean all of us, are cost conscious.
Yes.
And it means, therefore, that we should be opting for the version that would allow us to stretch our money longer.
Correct.
You know, again, one of the things that we raised at the beginning is that drug costs are one of the major cost drivers for most of our health plans, and we want to be able to provide coverage that will take you through the entire year. So we want you to A, be healthy, and B, we want the money to last. And so we're saying make the choices that will best serve you.
Correct,
Right.
correct, correct. All right, so these are actual patient cases, and this is something that, okay, thank you. These are actual patient cases. And this is something that I want us to really take a minute to look at. This is one patient. One patient. Some of us may have relatives who have what I call a shopping list of medication. So you see, prescription number 1, that's one doctor. Prescription number 2 was another doctor. And prescription number 3 was a totally different doctor. So we see polypharmacy in its live and living colors. Once you see a patient like this, so I am actually calling you to action. If you have any family member, friends, co-worker, and their prescriptions are looking like this is a red flag. This patient is in toxicity. Without me reviewing this patient is in toxicity. This is not something that is ideal. What happens oftentimes too is, if a patient is failing, it could be non-compliance or non-adherence, meaning the patient not taking the medicine. Oftentimes, the doctors will keep adding more and adding more and adding more to bear out the new symptoms, the new onset, not thinking we could perhaps reduce some of these, because some of these onset of new symptoms are actually side effects of the medications that patients are taking. So for this patient, in terms of drug interaction, there were 16 moderate drug-drug interaction and 3 major drug disease interaction. And I'll tell you that this level of risk, it has no prejudice, because this patient was a registered nurse. So somebody who's in the healthcare industry. And this patient only started out with type 2 diabetes. And the type 2 diabetes led to all of these complications because it was not managed well. Unfortunately, this patient, quality of life did improve, but the quantity, it was too late when I got this patient. So the only thing we could do at that point in time is make the patient as comfortable as possible, because this patient broke out in a lot of things on the skin. It was pure torture. And we discontinued a bunch of stuff. The patient, I would say, passed away peacefully, from agony to peacefully. So we say we have to intervene from early, and we cannot think that, oh, I'm a pharmacist, I'm a medical doctor, I'm a nurse, so this cannot impact me. Slowly it creeps up, because all of us always think the doctors know best, the people who are managing my health knows best. And again, I'll reiterate, we have to become advocates for ourselves.
Doc, could I just jump in right here? Because you speak about you getting involved early. If we can go back even earlier than that, something like diabetes, most of the time, type 2 is preventable.
Correct.
So it is so difficult because we're busy, we work for organizations, we want to put our best foot forward for the organization, but it is your health. So when you tell me you don't have time to eat well because you don't have time to go home and prepare your meals, I'm going to tell you that it is better to make the time now than to face what you just described.
Complications like that.
Absolutely.
Absolutely.
All right, so just for the information of those in the room, we have had a little fluctuation in power. So that's why you're hearing a little difference in the mic, but I understand that the virtual audience is quite fine. So thank you for hanging in there with us. I'm just going to take this moment as well to remind persons online, we want to know who you are, and you will have a chance to win some prizes at the end. So for persons who have joined us virtually, please remember to drop your groups in the chat so we know where you're joining us from, and also stand a chance to win some of the prizes at the end. So thank you for understanding. Thanks, Doc.
Okay, thank you. And so I did say I'd share a perspective from chronic. So now I'm sharing the perspective from an acute patient and how it is that this level
Remind us, Doc, what chronic versus acute means.
Chronic, long-term illnesses, so these are what they call, and I always like to say quote unquote, because I've seen patients who started out on medications, and because of the lifestyle adjustment and the proper clinical governance, they're able to be tapered just to lifestyle habits and practices alone. So chronic is more long time. We expect to be on medication for quite a long time. All right, so our acute patient, we'll call him LC, teacher by profession. He had a respiratory infection, which is common in and around the winter time. He was prescribed the right antibiotics for his infection, and post his antibiotic treatment, this patient ended up with what we call an aggressive response to the antibiotic therapy, where he became allergic to every single thing that he was taking by mouth. So both food and medication, he was allergic to every single thing. When I got this patient, the doctor who recommended the patient was like, Melissa, we're first name basis, so Melissa, like, this is my patient, what's your viewpoint on this patient? And when I looked on the course of antibiotic treatment, I'm saying this patient seemed to be suffering from dysbiosis. So dysbiosis is when the normal flora, that is a normal gut flora in the gut, changes because antibiotics are not specific. So the bacteria in our guts, every single time when we consume antibiotic, we deplete some of this good bacteria in the gut. Okay. This patient had a super reaction to that, and he became allergic to everything. So we went in with some probiotics, and once we went in with that, our patient returned to normal because what he needed was a replenishment of the gut flora. How many of us knew that when we take antibiotic, we really needed some probiotic? Very good. I'm happy there was somebody, yes. 3 persons in here knew that. Yes. 4. So that's very good. So this is why, these type of talks really help us. So the next time we come out of here, doctor prescribe antibiotics, we'll ask for some probiotics as well because we recognize the risk that exists. And hence why we're saying this type of governance really do help our patients. So this was short-term therapy, but it had a major impact on the patient. Right. And I have this up here because I don't know, again, it's our culture. And we treat our doctors like demigods. And because we treat them like demigods, we don't ask questions. Now, I say, if we're going to become advocates in terms of our healthcare, we must ask the necessary questions. We need to ask the what. Too many times, patients turn up to the pharmacy with a prescription, taking something by mouth, and they don't know what the diagnosis was. We need to ask our doctors, these were my symptoms. Yes, you're writing on this white paper. What is my illness? What is the name of my illness? If it's too long for you to remember, let him write it down, or you write it down. You need to know what you're being treated for. The treatment, start the conversation with the doctor. What are you prescribing for me? It helps when you go to the dispensary. Have you ever tried to read a prescription? Have you ever gone to the dispensary and the pharmacist is trying to figure out what is on the prescription? And here is why we need to become personal advocates again. Pharmacy is a business. A business is in it to make money. If you don't make money, you don't have a business. And when you play naive and you don't understand, not every pharmacist will tell you, I don't know what this is. Some persons will assume, because there are certain clues that we pick up as pharmacists that allows us to assume, and they may take an intelligent guess, but an intelligent guess may cost you your life. If you know from the doctor's standpoint what you're being treated for and what you're given, once that pharmacist dispenses to you, you know, is this my correct medication? Too many times patients leave the dispensary with the wrong treatment. Thank God, a lot of the times it didn't cause any harm to the patient, but it does happen. What are the side effects? How many of us are taking medicines and we don't know what the side effects are? If you don't know what the side effects are, you don't know what to look out for. And I tell you how this plays out. You go to Dr. A prescribe you start taking the medication, you're feeling worse or unwell, what do you think you do? Go back to Dr. A? No. Dr. A is no good doctor, you find a new doctor. But it could be a side effect of the medicine that you're taking. So these are the whats that we must ask. How? How is it administered? How many of us know that there are certain medicines that when you take it have special dietary consideration? You can't take it with a high-protein diet, a high-fat diet. This should be taken on an empty stomach. This should be taken on full stomach. This should not be taken with your multivitamin or this supplement. How many of us know that? We need to ask how we should take. Frequency. If the doctor writes twice per day, 3 times for the day, some persons will take it 9 o'clock, 10 o'clock, 11 o'clock. That is creating toxicity. But it said 3 times for the day. I will really take it 3 times for the day for true. So we need to bear those things in mind. The duration, how long? How long should we be taking this treatment? Is this an indefinite treatment that I should be taking? How long should I be taking it? Especially when it comes on to our, what we call antimicrobials, your antifungals, your antibiotics, your antivirals. How long should I be taking it? A lot of persons with antibiotics, they start taking it, start feel better, and what we do? Stop taking it. And then we were having a discussion with the health coach earlier with these superbugs. Some of these emerging bacteria that are so hard to treat is as a result of what we call resistance. And resistance comes about when we don't follow through with our treatment. So every single person that is prescribed an antibiotic has a responsibility to complete that course of treatment. It not only affects you, the individual, it affects the entire world.
Doctor, I just wanted to just step back one quick step and clarify. For the number of times per day, we mentioned that some persons may not know. What's the rule of thumb? If you have a medication that is to be taken 3 times per day, when do you take that?
All right, so if we have a medicine that should be taken 3 times per day, we try to space it by the 24 hours. So we say every 8 hours. If it's twice per day, we say every 12 hours. If it's 4 times per day, we say every 6 hours. Now, be mindful because some persons feel like these instructions are cast in stones and they can't change. Now, for every 12 hours, for example, if you take it 6 o'clock, which is a good time to take it, 6 in the morning, 6 in the evening, that's fine. But what if you start taking it 1 p.m. in the afternoon and then you're going to get up 1 a.m.? No, because some, especially these medicines that you space every 12 hours, it requires food. You don't want to be eating at 1 a.m. Kurt and our health coach here will tell us, no, we don't want that for our digestive system. So we have to be mindful. So for something that we take every 8 hours, we may not be able to space it strictly by every 8 hours, but you take it at a comfortable interval. It's a whole other conversation when we talk about the half-life of drug and what can take close and so forth. And that's why the individualization now, looking at you as the patient, becomes important to provide that guide. But as a general rule, if it says 3 times, you try to space it within the 24 hours. 4 times, you try to space it within the 24 hours, which is generally every 3 or every 6 hours, respectively.
Okay, good. Thank you.
And then when. The when is critical, especially when it comes on to chronic medications. So you'll have patients start taking chronic medication after a week and them say, but I don't start feel better yet, I gotta stop take it. The onset is very important, meaning how soon after I start taking my medicine should I start seeing the result of my medicine so that persons don't discontinue treatment prematurely. When to discontinue the treatment. So you have a lot of patients who start taking medicine, they're feeling way worse than before, and these patients continue to take the medicine and end up in the emergency room. So when we ask when to discontinue, we're asking about side effects again. We're asking about adverse drug effects. What are these critical signs and symptoms? If they are happening to me, do I discontinue my medication? All of these things become very, very critical. So the what, the how, the when.
So those are questions that we should be asking our doctors. That's
Correct.
what you're saying.
And pharmacists as well.
And pharmacists. Okay, so ask the question. You are the one who wants to get better, so ask the doctor. Doctor, how quickly will this medication start to work? And
Correct.
also, if I start taking this medicine and I feel, however, X, Y, Z, then what do I do?
Correct.
What do I do then? If I start taking it and I feel, I don't know, nauseous for a week.
Right. So if you start taking a medicine, because we're empowered people now, and we know we would ask what signs and symptoms to look out for. Perhaps the doctor did not mention, the pharmacist did not mention this feeling that you're feeling. Do not take any more of the medication. Go to your nearest pharmacy or go back to your doctor immediately. Because this could be something else. Because one thing I want to point out, and I'm happy you asked the question, a medication on the market continuously is being assessed. Remember now, when they launched these products on the market, the different genetic, we did not use every single person's or sample of every single population group for these studies. And whereas the Asians may respond differently from the blacks, the whites, and so forth. So we need to also bear that into consideration. So some of these adverse effects may not have been documented yet. And hence why we have something that is called pharmacovigilance. So although the product has been FDA approved and we say it's safe and so forth, and if you start taking a new medicine and you notice anything different, strange, or weird, you need to report it immediately.
And that's important for us, especially in light of our out of many one people.
Yes.
So
absolutely.
Our reactions may be a little bit different, so we have to be mindful of that.
Correct. Because medications have been withdrawn from the market a lot of the time. So it was pre-approved in the past, and we had to withdraw based on new onset of adverse reaction that was not picked up in the studies that caused it to come to market. So it's very important. So in summary, what I want to leave us with is to get involved. Very, very critical. We've been stressing that throughout the entire presentation. We need to understand the treatment that we're given, whether it's a 2-day or 1-day course, we need to understand it. And we need to know what illnesses we're being diagnosed with. It's very critical. Once we know these umbrella of things, what it means is that we are already a part of that clinical governance where we're advocating for our own health, and that is very, very critical. I thank you so much for your time and your attention, and I'm open to questions.
Yes. Thank you so much, Dr. Williams. And if there are any questions in the audience here now, we'll take them from you. I want to acknowledge our virtual audience. I'm having some comments. Persons are expressing also their appreciation. The section on explaining generic drugs was very well received, so thank you for that. And for those persons online, please remember to drop your group names as well. Is there a question in the audience? The mic is coming to you.
Oh, I thought I could do well without the mic. Dr. Williams, you made a point recently, and I think my friend there, Rosie, said she knew that probiotics should be taken after antibiotics. But how many doctors prescribe that as part of the regimen? That is like malpractice, shouldn't it be?
It's not malpractice. It's not malpractice. So, and that is why I look forward, and I say this, I look forward to a Jamaica. So now that we have medication therapy management, I think it will begin to make a world of a difference in terms of the level of care that we give to patients. Now, when we look at the discipline of clinical pharmacy versus medical doctor, you recognize that in terms of the vast majority of the course for medical doctors, it's diagnosis. So they're the experts. As clinical pharmacists, we may have an idea what is wrong, but we're not the subject experts. Medical doctors, they do undergo training for pharmacotherapy as well, but they did not spend 8 years, 9 years studying pharmacotherapy, and as such, they are not the expert. So what it takes is communication, what it takes is collaboration. And one of the things that I've been doing, and which I must report in terms of from the medical community, they have been very, very receptive in terms of my interventions and suggestions, and I have begun doing clinical meetings with them as well to share with them some of these things that should be added to therapy because they may not have been exposed in medical school.
Okay.
Yeah, so we are privileged to be in the minority who are now so educated. And I'm really just pressing on those present and virtually, especially our HR and benefit managers, to please share the information with your teams. Pass on the information. I mean, this is one of many that we hope to have in the future. And we will be having some more webinars and online seminars, and as best as possible, come to you as well with the information, because we really do see the value in it, and we see that it can make a big impact not only on our quality of life but on our pockets as well. And so we really do want to keep this message going. There was another question?
Not a question, a comment. Good morning and thanks for the detailed presentation. I must confess that I've benefited well from the generic versus the brand. And I really think I owe my pharmacist an apology because I would argue with him consistently for offering me or giving me generic drugs. How dare you, when I can afford the brand? So now that I know that there's no difference, then it will save me some money.
Yes.
As it relates to the disposal of the drugs, and you mentioned that we could have that discussion with our pharmacist, I also think that the pharmacist should be able to recommend this. Because, I mean, over the years, we have been getting medication, and they do when you go. And I must commend my pharmacist. I'm told of any side effects or my drug is to be taken, but then I've never heard or known that I could take back my unused drugs to the pharmacy. So that's something that they could recommend to the patients.
Okay, and I think that's a very good point as well.
Okay. Rosie here, other question? At the front?
So riding on the generic versus brand, and I know our portfolio manager will be happy to hear when I say how you can also write your health insurance plan to help with your utilization for your organization is that you offer a better benefit for people who buy generics. So for example, with our plan, you get a 90% coverage if you purchase generic drugs versus 80% if you use brand, and if you purchase brand where there is a generic, it's only 70%. And we also educate our employees on that, so that way as well, it is better on their pocket.
Correct.
And also remember that there's NHF, so if you use NHF as your first provider, it maps out everything and your employees are happy, your utilization is better, so it's a win-win situation.
It's a win-win.
Absolutely.
Of course, it's Ray Johnson, and we have the best agent ever, Barbara Grant. Barbara Grant is like an employee. People think she's employed too. So we have our best Sagicor team.
Thank you so much for that plug, Rosie. And I'm not quite sure if persons online or listening, the reminder there is, of course, the benefit from the financial, the less cost for the generic, but also remember that NHF is there to cover most of your critical illnesses. So use that first before your health insurance to make sure that you benefit from all of the lovely taxes that you have been paying and so on. We have a comment from Natalie.
Sure, I'm loving the conversation about the probiotics, but I just wanted to do a little bit more education that probiotics, just like vitamins, there are different types of bacteria, there's different species. So something that is just over the counter, you may be familiar with something like a Lactobacillus acidophilus, that in and of itself is one bacteria, right? So if we've done the broad destruction with the antibiotic, we need a similarly broad replenishment
Which
with
is
the
usually
probiotic.
prescribed.
But there are some over-the-counters. But I just want to caution that a single strain that you're going to grab up on a pharmacy shelf may not be exactly what you need. So this, again, is where you could have a conversation with myself, your medical practitioner, to advise you on which probiotic would be sufficient.
Okay, so we're saying be empowered, but seek
consultation.
Advice. Consult for the proper advice, right? Because you don't want it to be reversing all the beautiful gains that you would have had.
Correct.
All right, let me see if there are any other comments or questions from persons virtually. Okay, so they're saying thanks to you, very informative, and they're saying it's very clear, which is why we're not having so many questions. The doctor warned against using multiple doctors. However, persons might do this to get a second opinion, as we at times experience situations where patients get wrong diagnoses. What's your comment on that, Doc?
I'm always open to second opinion. I always say we have this 4 sense, and if our gut's feeling tells us that something is wrong, then I recommend that we take a second opinion. I've had patients that had to say, you know what, I recommend you get a second opinion based on, I will not, because we're all a part of the same medical community, we're not trying to, from ethical practice, we're not trying to say this doctor is not good, that one is not good, but we may see some sets of reports from your lab, something just not adding up, and we may make that recommendation. As a patient, you may, from the interaction with the practitioner, you may not have been so comfortable, perhaps he wasn't as thorough, and as such you want a second opinion. What I'll say with the second opinion is be open and honest with the next doctor that you visit. Take to that doctor whatever information was given to you from the previous doctor, what prescription drugs were prescribed, so that that doctor has full visibility in terms of what that assessment was. And I throw something else in there, I promise you. Most of the times when you go to a doctor, if you go to Dr. A, you're prescribed a set of things. When you go to Dr. B, you're also prescribed a set of different things. So we have to be careful too in terms of how we maneuver when we say on our own we're going to just get a second opinion, because sometimes it results in patient confusion.
Okay. Would it help if when we go for the second opinion, we let that doctor know you are a second opinion?
Correct. That's what I'm saying. So yes, it helps the process.
Okay, good. So we're not just going and we're making sure they know, because we would have been probably taking some medication recently that we know it would be good for them to know. So Marianne, I hope that answers your question. Lawrence asking if we're going to make a copy of this recording available. The answer is yes. We're building out our content on our Wellness Hub, and so we're expanding all information, and you will have this information, and we will also be having more sessions in the future going forward. So to also acknowledge the teams that we have online so far: Team JPS, yeah, Conduent Montego Bay, yeah, Toyota Jamaica, Manpower and Maintenance Services, yeah, come on, cheer them on. Couples Resorts, we have TJAM, NSWMA, Yellow Media Team, Team Louis Industrial, Cygnus, eGov Jamaica, Flow, Thetford, MCAJ. So we have a pretty big audience, and really wanted to congratulate all our execs and our HRs for allowing the time that our people can really get informed, because we're really hoping to make an impact on your lives going forward. Let me make sure that I'm not missing any comments here. I think I've gotten them. Quickly. Okay, Suzanne, we will have your advisor address your question we're asking about when your health card runs out. Because we have so many different groups on with so many potentially different plans, it can't be I can't answer that question in one way. So we will address yours individually, because we have different coverages for different persons. But Tiba Kanan is asking, should we ask the doctor to prescribe a probiotic along with an antibiotic? Should we have to ask them that?
Yes, you can ask.
We can ask.
So once he's prescribing an antibiotic, you can say, Doc, I'd like to take some probiotics as well.
Okay, great.
So that, to our health coach's point, you're getting the correct probiotic that is needed based on the antibiotic that you're taking.
Okay, great. So I know we're over time, but I thank you for your indulgence.
Yes.
Go ahead with your question here.
Yes, also for children.
All right, so are there any more? We have another question. Go ahead.
Well, not really a question, just a comment. Yeah. Thank you, Barbara, for putting me on the spot. So, at my company, New Fortress Energy, we just did our first wellness screening, and the reception was really good.
Thank you.
So it'll be something that we continue, annually, and I just want to encourage all the companies here, HR practitioners, that this is a very important initiative. I got feedback from an employee yesterday morning, and he said, "Boy, Italian, you know, the screening, it saved my life." Oh. So I said, "How so?" Because he is one of our kind of fitness ambassadors, right? Ambassadors, sorry. Right. And he said, "Well, you know, I've been on this wellness journey. I lost this weight. I changed my diet and stuff, and I came off my blood pressure medication. So when I did the screening and my reading was extremely high, I was really surprised. But he said he went to his doctor immediately, and they got him back on the medication. So had it not been for the screening, which I think it was week before last, no, Montego Bay." Yeah, week before last, yes. He would have been going along thinking his numbers were okay, based on his lifestyle changes, right. But it really wasn't. And it was alarming. I don't remember the number, but it was really alarming. So I just wanted to thank the team, right?
You're most welcome. Jane is outside. I'll pass it on to her.
Yeah, it was a very successful thing. So thank you to Sagicor.
No, we really, yeah.
Right, so I'm happy that just one short minute, I'm happy that she made that point, because we talk about how lifestyle can change our chronic illnesses. But for blood pressure and for many other chronic illnesses, even though lifestyle can change it, sometimes the reason why the blood pressure was spiked wasn't just due to weight, wasn't just due to diet, but there are what we call organic illnesses that is creating that blood pressure. And why we say never stop taking any medication, except in the case where you have adverse effect. You stop taking medication only when you're being supervised by a trained professional.
Okay. Well, thank you so much, Dr. Williams. Yes, I usually ask for the antibiotic once I'm prescribed, the probiotic once I'm prescribed, all the time.
Excellent.
I'd like you to speak a little, even though this was not one of your drug that you mentioned, but when someone is on prednisone, how do you, like for atopic dermatitis, how do you actually get that person off?
Right, you need to taper. So usually you start with a very high dose. Some patients start as high as 50 milligrams. And the frequency in which they take it every single day for a short period. Some doctors will just abruptly stop it within a week, 2 weeks. But the correct thing to do is to taper. So how do we taper? You start the patient first at 50. Then you take that down to perhaps 40, 30, 25, 10, 5. And then 5 alone, you don't just stop. You say 5 alternate days until you eventually stop. It's very, very important to taper and not to abruptly discontinue. But sometimes the prescription abruptly discontinues the prednisone, which is hazardous to the patient.
Okay, thank you so much.
All right, thank you, Doc. And are there any more questions? Any more questions online? I'm not seeing any. Let me see.
She has a question in front.
Oh, go ahead, please.
All right, so good morning again. Thank you so much for joining the team. It has been very informative.
One of the things good morning again. So one of the things I have always appreciated about Sagicor is the information that they have always relayed to their customers. The access to your mobile unit, as you mentioned, because we do our annual medicals with you as well. Right. And Barbara and the team have always been available to have sessions for our employees. So it's great that we know that we will have this video to show with you. And even from an information session aspect, I think it would be such a great idea for us to even go in depth in terms of the analysis and just getting back some of the names with the prescription utilization rate from Sagicor to say, hey, this is a session that may be mandatory for you so you can get some additional numbers and information because you may be experiencing this and not even realizing that these are factors that are affecting you as an employee. Because I'm sure a lot of persons like myself was not even aware that, hey, I never thought to have my 2 doctors have a discussion about the medication that they're giving to me. So really just want to thank you.
You're welcome. So to that point, one of the reasons we're having these kinds of sessions to empower you is because we need you to initiate a lot of these actions. With the new Data Privacy Act, we can't just pull your records and say, hey,
Correct.
you do this.
Right.
Because your right to your information is just that,
Right.
yours. And so you have to give us express permission to utilize your data in that way, which is why when we come to you now with the mobile screening unit, you agree to give us permissions to look at your results and to suggest to you that you need to get follow-up treatment if necessary. So those are some of the things that we're putting in place to help you in that regard.
And that was even a thought, thank you so much, because I was thinking from the case of even reaching out to 2 doctors to say, I would like my information to be shared.
Right.
How does that work? Because each doctor, each medical institution may have their own data privacy policies and procedures in place, and that governs how this information is
Well,
relayed.
the new Data Privacy Act gives you,
Yes,
the person,
I know.
the
As the
owner.
I know.
So you can tell the doctor to
correct.
give you your information or share it with the other doctor.
Very familiar, but it's a very interesting age we are in right now.
Yes, and we're all still learning, and so it's a curve, and we're trying to help each other, and so your comments and your nudging us will also help us improve as well, and which is why, I have Dr. Williams and Natalie on board to help me as well, because while I have a vision for where this wellness program needs to go, I don't have the expertise in the various things. So I have these persons who are steeped in knowledge to guide and say, okay, here's something else that you can do. Right. And so we're guided by that.
Thank you so much, ladies.
You're most welcome. There was another question about, hold on, trying to get it back, about the probiotics, about in terms of potential adverse effects. Most probiotics in the live culture is destroyed, if this is true, and what is the guideline in terms of brands and so on?
So one of it's a really good question, because in order for a probiotic to be effective, it has to travel through the stomach into the gut, because that's where we want the repopulation to occur.
Right.
And the stomach is an acidic environment. That's why one of the brands that we carry at the Life Store is one of the top brands globally, and the capsule is designed so that it makes the journey through the stomach acid and does not start to dissolve until it gets into the gut, which is where it needs to be. So, yeah.
Right, so to the question as well, so the probiotics are really weakened strain of the bacteria, so some persons may fear of cross-infection that may happen in some patients. So patients who are immunocompromised, meaning patients who have a very weakened immune system and are not controlled in terms of their immunology, we really don't recommend that these patients go on probiotics, because even though it's weakened strain, it may cause harm in those patients. For examples of such patients would be HIV patients who are in active AIDS, who is in active disease. A patient like that, we wouldn't recommend probiotics to calling a name I shouldn't have. You see, muscle memory. Right, so we have to be mindful of those patient groups. But regular patients, no. And antibiotics does not impact it either, because of different technologies that they use in terms of the delivery systems.
Okay. All right, great. Thank you. And shout out to Singer Jamaica, who have signaled their presence in the virtual space as well. All right, one more question, and I know we have to wind up soon, but thanks for the interaction. We really appreciate it. Yes, Isha, go ahead, please.
So one question for Dr. Williams. Yes. I notice with many medications we're seen to avoid grapefruit. So generally with high blood pressure meds. So my question, and also for Natalie, can we just start taking grapefruit? Why don't our doctors tell us about grapefruit? Grapefruit will lower blood pressure as well. So how about taking grapefruit instead of the medication that has all these side effects? Why say do not take grapefruit, avoid grapefruit? Some persons don't even ask the question why avoid grapefruit, but my mind will go. I want to know why you're not to take grapefruit with high blood pressure meds. So, can we replace this with grapefruit? I know you won't know the measurement or anything else.
The short answer is no.
So, okay.
And I'll try to be as comprehensive but as clear as possible. So there is an when a drug is being metabolized, right? Meaning it's being activated to create the result that we need. Grapefruit, fortunately or unfortunately, goes through that same pathway. So even though we may get a little lowering of the blood pressure, the potency of grapefruit juice is not enough to control blood pressure. In addition to that, while grapefruit juice travels the same pathway, a lot of these medications that we're taking not only causing a direct impact on the receptor site, meaning at the target site to lower blood pressure, but they're also impacting other systems that also helps in the long run to reduce that blood pressure. So in patients who perhaps is both dyslipidemic, meaning high cholesterol plus high blood pressure, the blood pressure medicine is not just lowering that blood pressure, but it is also causing the lowering of that cholesterol in an indirect way. So it's not just in isolation as it would be a grapefruit juice. And the final point to that is sometimes the amount of consumption that you'd have to do with grapefruit to get the same result in terms of just the isolated lowering, you could not consume that in a day.
All right, great. Thanks. All right, let me ask you now, Doc, to give us a question for the persons on the chat to win a prize. And Natalie, I'm going to ask you to think of another question as well, so we can give away a prize to some of the persons on the chat, because you have been with us and you have been patient. What easy question we can ask them?
Should I go easy or should I go hard? All right, so at the beginning of the presentation, we looked at what medication therapy management was. Who can remember the just 3 words for the 3 actions that we do in terms of clinical governance?
So we're asking the people in the chat. You in here can answer me too, but we're asking the persons to put the answers in the chat to win.
Just the 3 first bulletin, the 3 things that I started out with. Let's see who has been paying attention now.
There's a hand to the
That's
back.
too hard? Stacey, is that one too hard?
No, I think you can ask that. I see persons in orders have their hands up, so.
Excellent. She deserved the prize. Yes, that's it.
All right, and let me have your question. Oh, we have a winner in the chat as well, but you didn't identify yourself.
I'll take the prize.
Person, LIG, I'm not seeing the name, who answered. Make sure you put your name in your full name and your company in the chat so that we can reach out to you to get you your prize. All right, Natalie, what's the other easy question we're going to ask now?
Easy question. So you're on prescription medication. You'd like to start to reduce that. What should you do?
All right, so persons are online. I hope you're hearing that. Repeat the question, Natalie, for clarity.
You're on prescription medication. You'd like to start using more natural. You want to reduce the medication. What should you do?
It was easy.
All right.
Who is going to get the prize now? Everybody answered.
That's what that means. Everybody needs to get a prize? Well, I like that you're also bright. Let's see. All right. So we will have identify our online winner soon as well in that regard. Hold on. Consult doctor. And this is Adekoya, S. Adekoya. Right. Okay. Yes, that is the right answer. The consult your doctor is the right answer for the persons in the chat. All right. Can we give away 2 more prizes? Yes. Y'all look like you don't ready to go anywhere, so we can ask 2 more questions.
Yes. Me first?
Go ahead, yes.
What are 2 questions that you need to ask your doctor or your pharmacist now that you are empowered advocates for your own health care?
So,
what is my diagnosis and how long should I take the medication or what is the medication?
Very good. Very good.
And of course, there are some other options because you're asking the doctor a lot of questions now because you're trying to know. There's another hand. Yes. Right, because you're trying to.
Right, so more persons can answer because there are other questions.
Yes.
You need to give 2 to get your prize. You don't want your prize? Do you have your prizes?
They're here.
I'm sorry. And generic, ask if generics are available.
All right, and there's another hand. You're answering the question too? Yes.
How long after I start taking the medication should I discontinue? And when should I discontinue?
If there ever should be a need.
Right.
There is something that came out in my mind, when he said generic option, if it's available. So there was a study I did at one of the private hospitals here in Jamaica with anticoagulation therapy. Big Pharma is forever coming up with new solutions, improved solutions in terms of our patients. The unfortunate thing is these solutions are usually very costly. And sometimes we have gold standard treatment that doctors may migrate from. So another important question that we can ask outside of whether or not generic is available is if any other treatment options are available. Because a lot of time patients start the medicine again, it's a new innovative molecule, they can do it for 3-4 months, but they can't continue for the rest of the year. So we have to be honest with our pockets. And we have to empower our employees as well to be honest with their pockets and ask these relevant questions. So if in the case of anticoagulation therapy, we had patients spending for one medicine alone an average of 18,000 Jamaican dollars, one medication for the month. And that was reduced to a low of 3,000 Jamaican dollars because there was another alternative that was just as good as the newer innovation. So that's also another important question to ask.
All right, great. All right, so we have had a great discussion. I think we have all learned a lot, and we will have to continue the discussion. But as we wrap up, I want you to leave us with some final words. Natalie, let me start with you. Based on what we've discussed, what we've learned today, what words do you want to leave us with?
I'll always sing from the same song sheet. Take control early. We are human beings, we're not machines. We're designed to feed our bodies with the best fuel possible. We're designed to move our bodies. And we are designed to rest at night. And you will then give your body the best fighting chance against developing lifestyle diseases.
Thank you. Doc.
Right.
Your final words.
And I will end exactly how I started. Get involved. Become a personal advocate. Do not be afraid or shy away to ask questions. If you're dealing with a healthcare professional who doesn't have the time, who doesn't have the patience, who doesn't have the presence to give you the attention that remember, he or she is now working for you on behalf of you. Be confident, stand up for you because only you alone is going to love you alone in the best way that you possibly can. So become an advocate for self, be confident, ask the necessary questions, and don't be afraid to switch your doctors if you're not comfortable and you're not getting the results that you require.
Thank you. Thank you so much, Doc. And I think those are very perfect words to end on. In the wellness unit, we go by the slogan, do it for yourself.
Correct.
And that is a deliberate slogan because you are the best person to take responsibility for yourself. And so while we provide you with these resources and tools to educate you, to let you know what to do, what to ask, and we provide the guidance as best as possible, ultimately, you have to, 1, decide that you want to do what's best for you, and 2, you have to do it. And so between one and the other, it could be a long path, and it may not be a direct path, but some of us have up and down paths, some of us step back and start again, but ultimately, we encourage you to do it for yourself. Try to be consistent as much as possible. Put in steps to help you get there. Utilize the tools and people that can help you. And importantly, encourage each other. So we are speaking to you from your employee groups, sometimes just having someone else to encourage you to do the right thing or to make the right choice can make a big difference. So utilize your groups, utilize your resources, value the people around you. And at the end of the day, what we're saying is make sure that you're doing what's best for you. And remember, wellness is all the facets of you. So you want to take care of everything, your mental, physical, spiritual, all the different parts of you that make you. And at the end of the day, we can do as much as we can, but you need to do it for yourself. So thank you so much for spending this time with us today. We appreciate you, and we hope to see you again. And thank you to my panelists who have, really delivered some true gems today. I appreciate you, and thank you so much for being at our disposal, often at last minute. And we will just continue to do what we do. And thanks for being here with us, and looking forward to seeing and speaking with you soon as we continue the conversation of how we're going to stay well. So thanks and walk good. God bless. So at this time, let me invite Ray Johnson, one of our portfolio managers, to move the vote of thanks.
Thank you, Stacy. Good morning, guys. Oh, so this is my speech. So as we come to the close of our Empowered for Life, Empowered to Live Well forum, it is my distinct pleasure to extend a heartfelt vote of thanks to all of who have made this event a success. First and foremost, our sincere gratitude goes to, well, Nikki's not here, but if she was here, goes to Nikki for her generous sponsorship of the event. Nikki is the VP in charge of our department, so she will sponsor all of these events. Nikki has a very strong commitment towards wellness, so, it is important that we thank her for that. A special thank you to you, Stacy, our wonderful host and moderator. Your skills and guidance make this presentation very engaging, and we thank you very much for that. Our appreciation also extends to the Sagicor group marketing team, and Jada Azan, is Nikki's, is Stacy's right hand. They were able to meticulously coordinate this event and make this event the success it is. We are particularly thankful to you, Dr. Williams, Milicia Williams, our consulting clinical pharmacist, for sharing your experience, your expertise on medication therapy management. I like to call it MTM. Your insights have been very enlightening and very beneficial to all of us. I learned something about probiotics this morning, To you, Natalie Murray, I like your hairdo as usual. Your invaluable insight as a health coach, your practical advice and motivation, has provided us with the tool to improve our health, and we'd like to thank you also for that. To you, our guests, both here and online, we'd like to thank you for joining us and dedicating part of your morning to be with us. Your presence and participation have been integral to the success of this forum. And finally, our deepest gratitude to the Jamaica Pegasus Hotel for providing us with a beautiful venue and, of course, a very sumptuous breakfast. Your hospitality has greatly enhanced our experience today. Once again, thank you all for your contribution and participation, and we look forward, when Stacey have more of these events to plan, so we look forward to seeing you at our future events. Thank you again.
In life, the more you have to lose.
The more you love, the more you worry. The more you own, the less you sleep.
The more people rely on you, the more you have on your mind.
I have peace of mind,
knowing that whatever I own
and whoever I care about are covered by the very best.
With Sagicor Life and Advantage General, get life, health, and general insurance to help you protect what matters most.